Do you require a bone density test? Most doctors forget to order it. Hi, I'm Dr. James Machino. 1 in 4 women and 1 in 8 men over the age of 50 develop osteoporosis. And what we know about osteoporosis is that it's very preventable with the right diet and lifestyle and supplementation program. In fact, some bone loss is actually reversible just using natural interventions. But first you have to see if you're a candidate for major intervention, which means you need to have a bone density test done if you're a candidate for one. Because it tells you when you have a bone density test how strong your bones actually are and what your risk of having a fracture might be. From there you determine what your supplementation and exercise protocol should look like, and dietary modifications. We then know how much calcium you need, how much magnesium you should put into your body, how much vitamin D, and also the Icarian flavonoid from the epimedium herb, which has been shown to help recapture bone density that's been lost. So what is a bone density test? It's a specialized X-ray with not a lot of radiation damage to the body. It's not a regular X-ray, which only, if someone just takes an X-ray of your arm or your hip or your low back because you had some pain there, those are just regular flat films, as they're called. Almost 50% of the bone has to be lost before you start seeing osteoporosis on a regular X-ray. You can't wait for that. By the time you've lost 50% of bone, you're already way down the road here. So the medical profession is outlined with the help of Osteoporosis Society and sort of leading experts, their blue ribbon panel. They've outlined who should have a bone mineral density test. These are individuals who meet what's called the inclusion criteria. The problem is that in day-to-day medical practice, medical doctors sometimes forget to screen patients for this. Why? Because they get really busy with the person's chief complaint, ear infections and throat infections and, the high blood pressure and high cholesterol and who's having symptoms that could be a stroke. They get caught up in the moment with the chief complaint. And then if a fracture occurs due to osteoporosis, then oh my God, then everybody, wakes up. But by then it's too late. And if you have a fracture, like a hip fracture from osteoporosis, and you end up in the hospital, because you have to lie down, you can't really move, then that's how the fluid collects in your lungs, it becomes a pooling ground for bacteria. More than 20% of women die in the first year from the complications. 34% of men die in the first year from the complications because it happens to men when they're even more elderly, so their constitution is weaker. Here's what I want you to do. Click on the link below and read my review article on nutrition and supplementation and its effects on bone density, so you know how to manage your lifestyle. At the end of the article, it lists the people or the candidates who should have a bone density test done immediately. So check out the questions at the end, and if you answer yes to any of them, alert your medical doctor about this right away. And you need to get a bone density test done. It pertains to women and men, not just women, but also men. It's very important, so read the article right now. Now at machinohealth.com you'll see my other research review papers, you'll see footage from my live professional seminars, other downloads and videos and resources I've created. They're all there to help you lead a long, healthy, functional life. All my research review papers and teaching materials are complete with all the scientific references, so you'll see I'm only giving you evidence-based information on any health topic that you're looking for. So you should use machinohealth.com as an ongoing, reliable resource of health and wellness information for both you and your family. Thanks so much for watching.